All right, can everyone hear me? Good. Well, good afternoon. My name is Maria Brown-Spence, and if you are here for the Youth Mental Health Crisis panel, then you are in the correct place. So I'll start with a brief introduction. I'm the manager for member companies with the Entrepreneurs Foundation, and so we work with tech companies and startups to build their social impact strategies and how they want to get connected in the communities to increase team building and rapport amongst their teams. I'm also the founder and CEO of an Austin-based nonprofit called Hearts to Heal, which provides mental health and bereavement support to the community. And so this topic is very dear to my heart. I am not a parent, but we do have a mentorship program for Black teen girls that's led by 2 Black women licensed psychologists. And we've heard a lot of this conversation and topic come up within that group. So we would love to get started. So I did want to start with something that was just released last Thursday. So the Centers for Disease Control and Prevention is warning of an accelerating mental health crisis among adolescents, with more than 4 in 10 teens reporting that they feel persistently sad or hopeless, and 1 in 5 saying they have contemplated suicide, according to the results of a survey just published last Friday. So we are truly in a mental health crisis when it comes to our youth. So this topic is right on time, unfortunately, but we have an amazing panelist of experts that want to give insight and expertise to help you navigate this challenge. So to kick us off, I'd love to turn it over to Scilla Andreen to get us started with a video clip and share more about herself.
Hi everyone, welcome, thank you. I'm Scilla Andreen, I'm the CEO and co-founder of IndieFlix, which is a global streaming platform of content for purpose. We also have IndieFlix Education, which is where we create social impact films that we take out into corporations. We create programming around that so we can kind of not only open up the conversation, but keep it going. It has been a very organic process, and I came from Hollywood. I worked on TV shows, The Wonder Years, Party of 5, Dawson's Creek. Never thought I would be making mental health films and taking them into corporations and schools. But a friend of mine had asked me, she said, gosh, you make these films about bullying and empowerment and you take them out into the world, you need to make one about mental health. And I was like, no, I'm not going to do that. I think it needs to be made by a mental health professional. And frankly, I don't think anyone in a school or corporation would want to talk about mental health so openly. And she kept asking me. I worked with her. I saw her every week. And then I got a call on New Year's morning that she had died by suicide, leaving 2 teenage children and a husband behind. And I knew she was struggling, but I didn't know that it was that bad. And I think that's a really common statement that a lot of us make. And so I made Angst, which is the first in what used to be a trilogy, but now it's a collection of 4 mental health films. So I've made Angst, which I'm going to actually show you 2 clips. One is really about how anxiety doesn't discriminate, and then we'll do a second one basically on just a minute of about the science around it.
Anxiety doesn't discriminate. It affects us whether we live in a big town or a small city. It affects us if we're male or female, all gender, all races, everything.
I'm an immigrant, and my future is a little blurry at the moment, and it's just scary.
I have friends personally who feel that they have no choice whatsoever. They're into gangs and they're in the streets and they feel like based on the family that I'm grown up in, the block I live on or whatnot, I have to do this.
Everyone's dealing with some form of anxiety, part of the human experience. Johnny from an underserved community, he may not see his parents because they're locked up or they're abusing drugs or they're just out and about all the time. But Johnny from the affluent family, he may not see his parents either because they're working all the time. And then you have the extra expectations that these affluent kids have as well. You come from a good home, you're supposed to do well.
It's very, very common that the expectation is just you're going to college, point blank. There's no give and take with that. That creates a lot of stress for young people.
In the old days, people didn't talk about college starting in 3rd grade. You shouldn't even think about college in 3rd and 5th grade. But I've seen little kids in my practice who literally have it monster under my bed, and I'm afraid that I won't ever get into college. And I'm going, where did they get this?
Definitely meeting up to your parents' expectations.
I'm behind the curve because I'm doing 2 APs instead of 3.
What you're gonna do for the next 4 years, like, it's kind of hard.
You know, just this feeling I get when I'm, thinking about colleges, I just start to get a little worried, and then it just becomes more and more dramatic over the next hour, the next 2 hours, and my head just gets cloudier and cloudier with all these different thoughts and worries. And so I get to this climax where my head is just buzzing, and I'm just like, looking around, and I'm just kind of trying to figure out what's going on almost. And at that point, I just have to drop everything I'm doing, go get a glass of water or something, and just kind of try to calm myself down.
It almost feels like this generation is feeling the most amount of stress, which I know is probably not true, and definitely the generations that came before my generation felt stress too. It's just, I think that people are talking about it more.
Yeah, we're better at identifying anxiety and depression. Anxiety is something everyone feels, and I think we are better now at determining what causes an anxiety disorder versus having more of just plain anxiety.
So that was, that we break the film up into chapters so that we've learned that people like to have access to those chapters again, and then discussion points. So who knew we were going to make a movie that was so evergreen and chopped up into little pieces. Now we have just a little 1-minute clip about just a little bit of the science about what not just our kids can deal with, but us as well.
It's very common for kids to not know, and even more common for parents to not be able to recognize that anxiety is the reason they're struggling so much.
I would go to the nurse and they would send me home because I just had these horrible stomach aches and no one could figure out what it was for a really long time. And then I'd be super nervous and anxious about all the school I was missing, and then they would get worse.
I can't tell you how many times I will tell a family the reason why your kid has chronic abdominal pain is because they are too anxious about school, or they're so worried about how they're going to do at the basketball game, or they're scared that their parents are going to be deported, and that's why their stomach hurts. And that's a big leap if you think about it. How can that possibly have anything to do with the brain and the stomach? But it does. Because if you think about it physiologically, that if you create a chronic stressful condition, worrying, that raises your cortisol level, which is our internal steroid, which raises the amount of hydrochloric acid in our stomach, which is not okay, and your stomach hurts. Your heart starts going faster, your eyes dilate, your mouth gets dry, your hands get cold, your muscles get tight. And if your muscles are tight for a long time, then you start hurting. Your back starts hurting, your shoulders start hurting, your neck starts hurting. If you furrow your brow for too long, you'll start getting a headache. If I explain it that way, like at a very basic physiologic level, people get the aha, they suddenly have a moment of awareness.
So I want to bring in one more statistic, which is important too, because sometimes you have to hear the data to understand and connect with it. So the CDC survey paints a portrait of a generation reeling from the pandemic, grappling with food insecurity, academic struggles, poor health, and abuse at home. Nearly 30% of the teens surveyed said a parent or other adult in their home lost work during the pandemic, and a quarter struggled with hunger. 2/3 said they had difficulty with schoolwork, which we also know there was a digital divide that took place during that time. But the survey also offers hope, finding that teens who feel connected at school report much lower rates of poor health, and the finding calls attention to the critical role schools can play in a student's mental health. And so as you saw during the pandemic, a lot of parents also had to become educators and instructors while they navigated work. And we saw many children hopping on Zoom calls with C-suite leaders as well, which put another lens to the human dynamic to say, oh gosh, this is a leader just like me navigating the workplace, and the kid hopped on with pajamas All right, it brought another human level to it. And so I really like to ask you, Marti, with you being a parent and the executive director of On Our Sleeves and really having that connection with the youth, how are you supporting your well-being and encouraging others to support their health as they have to navigate this world of being a parent and being an employee or being a colleague? What are some tips that you could give?
Thank you for the question. I'm so glad all of you are here. On Our Sleeves is a national movement for children's mental health and wellness, and it's based on the concept that our kids cannot wear their thoughts and feelings on their sleeves the way we can. They don't yet have the verbal skills, perhaps, or even the understanding, and maybe they're saying it's a stomach ache. So it's up to all of us around them, the adults, the teachers, the coaches, the counselors, the parents, the Girl Scout leaders, all of us, to try to understand a little bit more about what's going on with these children and how we can best help them. It's true that 1 in 5 children, before the pandemic, we knew 1 in 5 children was living with a significantly impairing mental health disorder. And we also know that 50% of lifetime mental illness presents before the age of 14. So On Our Sleeves came to be simply so that when we talk about mental health, we don't forget to talk about the kids. And all of this began before the pandemic. And in 2019, Nationwide Insurance, which is one of our major corporate partners, came to us and said, we really think we need to look at the impact of child mental health on the workplace. And they used the word workplace because in 2019, we all used that. And we were excited about that idea, and we thought, yes, this is something we absolutely want to dig into. Well, fast forward, we never could have known what was coming, not only our way, but everybody's way. And so we dove in 2020 to designing some research to better understand this connection. And what we learned is that parents and caregivers overwhelmingly are concerned about their children's mental health and well-being. And we see far more parents citing concern. We see 6 in 10 parents citing concern than our 1 in 5 children with the mental health disorder diagnosis. And so what we know is that the concern group is much bigger than the necessarily diagnosed group. And that could be for many reasons. It could be lack of access. It could be the current trend of what's going on during the pandemic. So what we realized is that more and more parents and caregivers are feeling these worries. And this is not just the stress of, will I make it to daycare pickup in time? Or what if I miss soccer practice? Or, oh my gosh, it was, my day to do the teacher gift and I forgot. This is my child withdrawing into their room and thinking dangerous thoughts? Is my child's misbehavior related to perhaps it's anxiety, perhaps it's worry, perhaps it's unsupported learning needs that don't necessarily fit a mainstream model and certainly don't fit a Zoom model, to your point. And so the worry that parents and caregivers bring then to their work showed up as 30 to 50% of their mental time at work being over here worrying about their child's mental health and well-being and emotional development and behavior. And so our research took us over a year to conduct, and along the way we did some curriculum design with a resource for employers to roll out to parents and caregivers. And it's all available now. It's called The Great Collide is the name of our research report, because that tension we heard so strongly from our respondents. They told us, I feel like an elastic. I feel like a hamster on a wheel. I feel like a juggler. I feel like a ball of spaghetti that I can't get quite untied. And my personal favorite was the air traffic control metaphor. I feel like I'm in the tower directing all the time. And so our research study and our resources that we've been deploying through On Our Sleeves are designed to alleviate some of that distraction. And I am going to answer your question, which is, it's the notion of putting your oxygen mask on first. So at onoursleeves.org, we have all kinds of resources for parents and teachers and coaches to think about and have conversations with kids. But the number one thing we tell everybody is your own self-care has to come first and come alongside. There's so many metaphors, you can't pour from an empty cup and all these kinds of things, but it's really, really true. And I think what we saw during the pandemic is when you take away an adult's coping mechanisms, you take away a child's coping mechanisms, and then you sort of isolate them together. And of course the adults are supposed to model sit and don't solve, listen to their stuff, I think many times we may know what to do, but doing it is a whole nother thing. And there's there's a significant amount of parents and caregivers who don't know what to do, because how many of you feel like you grew up with mental health skill development as part of your upbringing? I call us Generation P for pivot. The people who are parenting right now are trying to, in one generation, turn this around and create a space and learn skills and talk to kids about mental health when it probably never came up, or if it did, it wasn't in like a positive way necessarily in our upbringing. And so we're trying to upskill all the grown-ups who surround our kids. We, of course, want to support them when they need treatment, but you probably know the waiting list to get a child into a therapist is 6 months or more. So we work on what happens in that 6 months. What happens in the 6 months before you even made the call, when you weren't sure if you should make the call because you knew there was a long waiting list, but you're really getting worried. That's our space to try to help parents and caregivers and coaches and teachers so that when they go to work, they can focus and they can really feel connected.
And I'd like to ask you, Sheila, with the films that you're creating as an opportunity to start or evoke dialogue, how can companies empower their employees to step up and take the mic essentially to talk about some of these tough topics?
Well, I think I can speak to just what we've seen in the workplace. And I've already talked to these companies, so they don't mind that I share this. But we did a screening for Starbucks corporate and at corporate headquarters, and we had about 800 people in the room. And we also, a week later, did a screening at Goldman Sachs with about 800 people in the room with, expert panelists and all that stuff. Starbucks, their culture was slightly different, so there was a lot of sharing about being on medication, getting the whole family into counseling. There was tears, even to the detail of getting the dosage right, like on a medication. But just being vulnerable, leaders being vulnerable had the most profound effect. It just gave permission for everyone to say, you can show that human side a little bit more at work, because we all know it's there. And then on the at Goldman Sachs, it was much more buttoned up. I think we had like 3 questions in the whole Q&A. And I actually thought maybe we didn't even like push our way through. I ended up calling the head of wellness later and saying, did it do anything? Was it helpful? She said, yes, we've got more engagement with our EAP. People are sharing in reviews. We're talking in the hallways and in the bathrooms and in the different groups and organizations. And so that was like just being able to talk about it. What people don't realize, and because Dr. Yursa Ben Halim, who is our licensed professional, isn't here, and I used to be at Sundance hanging out with filmmakers. Now I'm at mental health summits hanging out with mental health experts. They're my new best friends. And so I can share a little bit of what they say is that, our brains, what's really wonderful is there's science behind all of this. And when you're talking, especially when you're able to share, you're tapping into 3 executive functions of the prefrontal cortex. It's an action, you have to move your lips, you have to make a sound, and you have to form a sentence. And doing those 3 things, anxiety can't exist. You move the energy from the amygdala to the prefrontal cortex. And so even if before a presentation, I will recite the months of the year backwards, or I will do something just to trick my brain. Did anyone see Inside Out? Right? What a great movie. Who's in the controls? So when we can start sharing resources, and we know how guardians and parents are, we are like the force, right? Get a few resources going, some tips, things like that. We share with each other because we want, it might help. So when you open up the conversation, it changes corporate culture lickety-split. You can leapfrog. And then be able to tap into resources. You actually can make some meaningful, forward motion.
Okay, so this is a little more forward-looking, but I teach at-risk youth. I'm an equine therapist. I also recruit people at JDI. My oldest kiddo that I teach is 16, and I have spent 3 years teaching him to recognize the stomach ache as emotions and say the 5 things you see and the 4 things you hear and process through that. And I'm just curious, and it sort of goes to the point that you just made, how do we as a workplace prepare for an incoming generation of, I hope, kids and young adults who are now emotionally aware and more emotionally able to share and want that sort of like deeper level connection than we're used to. Like, what does the workplace need to do to welcome that generation, create a space where we foster it, as opposed to traditionally, not at JDI, we're perfect, but have shut it down in the past.
I'd like to.
Yeah, I'm looking.
So since I'm representing the employers here, what I would say is that we're already seeing that. So Levi's is a progressive organization. They have championed HIV/AIDS in the 70s, research, philanthropy. They've stood for lots of social justice issues over the years, many of them controversial. So why would mental health be a stigma in an organization like that? But I'm telling you, a number of years ago when we tried to tackle this, it really was a stigma issue. And it was really interesting to say that we could talk about anything except mental health. So what I'm finding is that that generational difference is changing already. And that with the new workforce that we're hiring in, access to mental health support, open conversation about it, needing to be as part of our work environment is absolutely ongoing. It's at the forefront. And I welcome it because it's refreshing. I often try to say that the only difference between your physical health and your mental health is about 1.5 inches. It's called the neck. That's all it is. But the stigma around it was just crazy. So where we are is we are dialoguing. We are opening up the conversation when we do a filming. We're going to show Angst during the May Mental Health Month. But we're going to kick it off with our CHRO doing a fireside chat, talking about her own mental health journey. And those of all of us, so that we're trying to, again, destigmatize it. But we have to have, the catching receptacles. Because once you open up the conversation, and people become more activated around recognizing it, then the resources need to be there. And there are lots of different initiatives that are underway. I know, for example, Meta is trying a peer-to-peer approach. It's looking like it's working pretty well for them. Traditional EAPs, yes, they're a resource, but we need to iterate beyond that. Technology is really helping with a lot of the solutions. But I also think that the way we're really going to get there for one another is to just basically mainstream this and make it completely part of our lives. That everybody feels anxiety at some level. Many people have depression at different times. Fear is a natural consequence, sometimes just to the reality of the world that we live in. Yesterday, I had a colleague mention to me that their son was feeling a tremendous amount of concern because of a shooting. How many of us have been touched by public or school shootings and violence or crime? Those are very healthy, normal reactions, by the way, to feel fear and anxiety in the face of danger. So these are all really healthy, wonderful things. And I think conferences like this and audiences like this that are engaged, who will then turn around and take this back into your places of research and work and champion for this to become mainstream, is an enormously hopeful opportunity to be able to say everywhere that we can all be whole and healthy and have these conversations, and we can all basically live the lives that we were created to live.
Could I add quickly that I think employers can also really invite the diverse perspectives of what different types of employees and cultures are handling. So in our data, we heard 85% of parents say, yes, it would help me to talk to another adult about my child's mental health. But then we asked them to rank who would they like to talk to. And guess who was at the very bottom? Their boss, their colleagues, and HR. And they were even lower among parents of color because the lack of trust in those conversations and settings really came through. And so I think there's so much opportunity to really, I mean, at dinner last night, we had a great chance to get different perspectives into that conversation in a way that we wouldn't otherwise have done.
And I'd love to touch on that part too, for the recognition of underrepresented or once marginalized demographics as well. With Hearts to Heal, we have what's called the Travis County Girl Squad. It's a mentorship and wellness program for Black teen girls. And this was based on a study from Georgetown University called Adultification Bias that shows, starting at the age of 5, Black girls are seen as needing less care, knowing of more adult topics and not as supported. And so we were able to find 2 licensed Black women psychologists to lead peer support groups to provide mental health education. We received 100 plus applications within 4 days for girls that wanted to attend this program, and were only able to accept 20. During that time, some of the feedback from parents were, my daughter is sharing more than she has ever shared before on some of the things she's experiencing at school. And the mom replied, and now I'm able to share with her to sometimes why I'm snippy after work because I've been stressed out and burnt out. And so really the importance of peer support and mental health education spans beyond any demographic to really have that connection with lived experiences to say we have more alike than we think. And that thread really came up during our dinner conversation. And from what we saw taking place over the pandemic, a lot of racial unrest. And I remember one time Eugene got on the phone with me and he said, "Hey, Maria, just calling to check in." I said, "Okay." He said, "I've seen there's been a lot going on. How are you feeling?" And this was with all the police shootings that were taking place. And I just started crying on the phone because I didn't realize how much I had pent up in me, but it also showed a human capacity as well to say, let me pause and let me check on my colleagues, because we are not in a space to where we can go to the water cooler and say, "Hey, how's it going?" Or see someone that might look a little more frazzled at the workplace. If you see someone coming in with their coffee and they're always spunky, you know that it's good to go. And if they're not that way, then you can say, I'm identifying something here. But it was easier for people to put on a mask on the Zoom call or decide to say, I'm just not going to have my video on at all. And so I want to ask you guys too, how can we empower employees to speak up with challenges? Because again, we hear this term psychological safety in the workplace that's trending now, for supervisors and managers to even empower their employees to feel safe to say, I'm struggling and it might be hurting my performance, but I need to let you know. So I'd open that up to anyone on this.
We literally put it on the agenda of our status meetings. There's a section at the bottom and it says, what are you doing in the upcoming week to support your own mental health? And we do a round robin share. And it's not just what are you doing this weekend? It's like, what are you actually doing? Is it riding your bike? Is it, taking your meds on time? Once it's on the agenda, it's like accepted right away. It's like, oh, now it's in writing, and so this is what we do. So I think you could even open meetings that way. I mean, to your point about this emotionally savvy generation coming in with all these vocabulary words, I mean, that's a great way to open up. How are you doing? How are you feeling? How are your families doing? And then being willing to listen.
And I'll jump in there too. We obviously embrace that as well. And then I heard this morning there was a reference to ERGs. And so we're leveraging ERGs very heavily because they're very important organizations. They're if you will, self-affirming, and they're growing exponentially. And I would say that they're a powerful influence on policy and programs, because it gives us the opportunity to hear needs and concerns and to address them. Interestingly, there are many of the traditional ones that you might expect. Some of them are nationality driven, some of them are gender, but the largest one we have, interestingly enough, and we've got dozens now, is the families with special needs. We were surprised when we had a C-suite executive who championed that and opened it up. We probably had over 100 people come into the first meetings. And the definition of a family with special needs is really interesting because it's all different perspectives. It's my parents had special needs, or I'm an adult now and it was never recognized and I have special needs, or I have children that need special needs, or I have family members, and special needs is all over the spectrum too.
Yeah.
So I think it's a very powerful leveling tool in an organization.
Well, I'd like everyone to give our amazing panelists a round of applause. And pat yourselves on the back for one, showing up to this summit to learn more and how you can support your colleagues in the workplace and also yourselves. It's been a long 2 years, so pat yourselves on the back, everyone. Doing a great job. Positive affirmation. But